Welcome everyone. I'm Walt Schoenborn, Director of Digital Media at scienceboard.net. We're here live at ISCT 2022, and I'm very pleased to be joined by Roman Vincent, Senior Global Director and Marketing at MaxCyte. Also, MaxCyte is our diamond sponsor for ISCT 2022. Roman, thank you so much for being here today.
Thank you for the invitation.
I very much appreciated speaking about Formula One before our conversation. We might come back to it in a little bit.
Another important topic.
Another important cell and gene therapy, Formula One. So in any case, I wanted to ask you a couple of questions about the industry just in general. Well, first of all, if you could just give us an overview of MaxCyte for those of us that aren't familiar with the company.
Sure. So MaxCyte, we specialize in the transfection step, which is the step where you re-engineer your cell with a technology that we have developed, maybe it was 25 years ago, using electroporation. So you have different steps when it comes to reprogramming, if you wish, the cells, and this is known to be the most critical one. This is a step where you inject DNA, mRNA, and so on in your cells, and it could be a lot of different kind of cells. It could be applicable to a lot of various applications in bioprocessing, cell and gene therapy applications. So we do specialize in the equipment itself, but we don't do only that. We have also a huge team of scientists, because the key is really to understand the cells, the biology that goes with it, and everything that's happening before and after these electroporation steps.
Yes.
And that is why we do have a team of scientists who spend time with the customers, with the collaborators as well, to understand and to really fine-tune the process. So we have a system that is scalable, because we do work a lot with academic, but the people would want then to convert into manufacturing, scaling up, doing it in GMP manufacturing, and so on. So we do cover all the steps before and after, but our expertise is really in this very specific step for the cell re-engineering related to electroporation technology.
Yes, and one of the things that you touched on briefly was collaborators. I know that you guys collaborate with a lot of, as you said, academic institutions as well as privatized businesses and others in cell and gene therapy. I wanted to ask you a question, just an overall, where do you see the biopharma industry going?
So for me, it all started pretty much 20 years ago, and it was mostly in the bioprocessing application. And there was already a kind of a revolution, because the pharmaceutical industry suddenly became biopharmaceutical industries, because there was a need for using biologics to produce something.
Yes.
The pharma industry was trying to convert their know-how, engineering, mechanical validation, into using biology, meaning cells,
yes,
for producing something. It could have been monoclonal antibody, protein therapeutics in any kind of form and shapes. And it was a tough situation, and completely different. Their goal was to try to use their existing facilities to produce something completely different. There was a big learning curve. Then there were a lot of different trends. I could use the term revolutions, for example, when single-use technologies came into play. Back then, the goal was to produce more and at a more cost-effective process. Then they realized that you can't really convert. You need to adjust. You need to understand the biology. And there was a new wave of thinking, like, if we need 10 times more material, does it make sense to have a 10 times bigger vessel?
Yeah.
And then they started rethinking what is applicable, and really for me, it's when the collaborative approach happened. They realized that you cannot be an expert in everything.
Yeah.
A lot of people keep saying the process is the product. That wasn't the case back then. They're like, oh, I am the expert of my product. I don't want anyone to know the recipe, because it's our know-how. But they realized that very, very early on in the process, you have to have the manufacturing scalability, commercialization, and you needed to collaborate. At the time it was frustrating, because I've been interacting with customers, and 15, 20 years ago, they kept telling me, we want you to be innovative, but not too much.
Right.
And I was like, what is too much? So for me, it really started with the bioprocessing applications.
Yes.
And then you have now those cell and gene therapy applications. This is the next level of complexity, but a lot of those equipments, processes, and even the approaches are the direct followers from the bioprocessing applications.
Yes.
A lot of single-use technologies that have been developed over the last 15 years are now being updated, used, and revisited for the cell and gene therapy.
One of the interesting things is from being here this week, and previously we were at another cell and gene conference that was in Spain about a week or so ago. And this is kind of leading into my next question for you. I would ask you, what are the key challenges that you see specifically in cell and gene therapy, and keeping in mind of where the different jurisdictions, if I might say, are with both the EU and then here in the States and globally?
So there are many different kind of challenges when it comes to cell and gene therapies applications. The first one is the cells are per patient for now.
Yes.
I mean, 70% are still in autologous. In other words, when you are treating the cells, you have pretty much the life of a patient in your hands, versus bioprocessing, where it's still cells that produce something of a molecule of interest, if you wish. In cell and gene therapy, the cells will be re-engineered and then injected back to one or several patients.
Right.
So the risks are higher. It's so precious, you cannot have a problem.
Right.
So the level of scrutiny and the level of quality, safety, everything could be 10 times greater than in bioprocessing. That's the first thing. The second one is everybody wants to standardize, automate, get a lot of data, but the input is never the same. Depending on whether you have a healthy patient or a patient that have been through a lot of different treatments already, or the age of the patients, the inputs, meaning the quality of the cells, vary.
So many factors.
There are so many factors. In addition to that, that's what we are trying to be doing. It's to put some standards. Today, that's why I was starting with the bioprocessing applications, because we've learned so much, but we still feel like we're scratching the surface. There's so much more that we need to understand at the biological level to try to standardize. Today, the major problem is also that it's so complex.
Yes.
There are so many opportunities for mishandling. There's a lot of,
missing a step along the way, and how it can throw everything off.
Absolutely, and that means we need highly skilled engineers, biologists. So the staffing is also important. The training is important, but more importantly, you have a lot of steps that needs to communicate, that needs to be connected, and you want it to be in a closed environment, because safety is a must in cell and gene therapy.
Yeah.
And you don't want to lose the cells, you don't want to deteriorate the cells, and you want to be sure that it is as safe as possible. Because again, the cells are the product, whereas in bioprocessing, the product that the cells produce, that's what matters.
Yeah, and from our audience on sciencemore.net, we've been such a strong bioprocessing audience, and now it's really within the last several years, it has really been a focus on cell and gene therapies and the challenges there. I know it's difficult to ask you this, but if you were to have a crystal ball and you see, maybe 3 to 5 years within cell and gene therapies, where do you see the future going?
3 to 5 years in that industry, it's like tomorrow.
Yeah, that's true.
So there are so many innovations right now. For me, we need to learn from other industries, like the automotive industries, not to get back to the Formula One, but the way the automotives are being built are so automated.
Yes.
Everything is so under control. COVID highlighted a lot of supply issues.
Yes.
It is not acceptable in our industry. You need to have so many things completely under control, and we are discovering that. But over the last 2 years, this is a good thing. We've been learning. There's a lot of implementation, and it goes down to the supply chain.
Yes.
It goes down to the very understanding of the plastic, the resin, not only the supply chain, but how it could potentially interact. How does it work? How do you connect tubings? So you have the mechanical part that to my point of view, we still need to really understand that better and improve that, because the future would be completely machine learning when you push one button with a lot of analytics, which is something we are discovering right now. Is
Yes.
we need new analytics, we need new sensing technologies, we need new connectivity in terms of physical connectivity, transfer fluid, but also the data.
Yes.
So that's the future, without losing the flexibility.
Yes.
And that's one of the greatest challenge.
You know, it's interesting because you had brought up a couple of things that, one of the things that I have been recognizing through this industry is from the pandemic that it made people pivot, and it just forced process changes in companies. And whether you had brought up supply chain issues, which were obviously a huge factor due to the pandemic, and also you touched on it earlier, workflow. You know, it's staffing, actually having personnel to be able to handle it, really driving the automation or driving the certain aspects in the manufacturing process. It's a super interesting time. So,
Absolutely.
yeah, well, Roman, I want to thank you very much for your time. Roman Vincent, Senior Global Director of Strategic Marketing at MaxCyte. Roman, thank you very much for being here with us today.
Thank you.